much.
Elijah.
Elijah. Thank you so much, Elijah. Hi guys. Hi Zimain. Thank you very much for hosting us again. It's quite a pleasure to be here. We've got a couple of people online, so maybe for their convenience. Yeah, so that's everyone. Smile and wave. Smile and wave, boys. Smile and wave. If you did watch Madagascar, hopefully you're not too old to watch or too young. Anyway, so we are here to the audience online. This is the monthly meetup that we have as the Zimbabwe Digital Health Society, and it's a good one that this is our first hybrid. So I think our first event, we had it here and it was in the lecture room. So that was fully, live or in person. Then over the past couple of months, we have been meeting online, or having monthly online webinars. We talked about electronic health records. We had someone give us an overview of what the global picture is like, the trends. I think that was Prof. Edward Kunonga. That was our last speaker. And those presentations are available online. If you get onto the LinkedIn page, you'll be able to access some of those videos. So now this is our first in-person one. We have a live audience and a live speaker who is flesh and blood. It's not AI. So yeah, we hope this will then be how we can get to interact. So we'll have this 1 hour of in person. Then afterwards, for those that have actually come in person, we'll then shut the microphones and then dive a bit deeper. So it's always good to meet in person. Right. So today, as Elijah mentioned, we are talking about the business. We're trying to understand the business of online medical directories. It's something that is, I think we are all familiar with, a problem that we have in health. That if you need a service, if you need an ambulance, which number do you call, if I may ask anyone? If you need an ambulance, which number do you call? See, young people have this arrogance that they are immortal.
Oh, yeah.
That nothing will happen
to them.
So it's like, I don't need health insurance. I didn't even need to know where the hospital is. I'll always be fine. Yeah, but that's a common problem. So I think on WhatsApp groups, we always have people asking, who's a good general surgeon? Who's a good plastic surgeon? Who is an ENT? Where can I find this? Where can I find a lab and so forth? So all of that, we have people seeking information, and then we have services that are kind of like meeting that need. So that's basically online medical directories, and we'll get to understand more as we talk to our guest. So going to our guest, we are quite privileged to have Dr. Dudzai Mureyi. She's a pharmacist, and when she came here, she went to the building that she only knows. She went to the pharmacy department. She's a pharmacist training, but then she went to do a master's and a PhD at the University of Edinburgh in global health. She's now a global health researcher, as well as a non-executive director at Net1. More interestingly, or one of the main things that brings her here, she's the founder and chief vision officer of MIS, or the Medical Information Service. She's someone who has certainly earned her place in the hero's acre of digital health in Zimbabwe, whether by blood or by so the key word is to say really earned. So really privileged to have her in person. So help me welcome Dr. Mureyi. Thank you very much. So Doc, you welcome to the Zimain audience, and then the other hundreds of thousands gathered online. We've really come to understand what you do. So maybe that's the first part to start. Good place to start. Yeah. You're already wearing a very nice sweater that says MIS.
Yes.
I hope you're going to do an Oprah and say, everyone gets a sweater. You get a sweater.
No, they get something much better, actually.
Oh, okay.
Yes.
All right.
So just a fun fact. Fun fact, phones will ring during webinars. But yeah, fun fact, something you might not know, actually something you all do not know, is that Marlon and I were born on the same day. I insist I was born hours earlier, but that remains to be determined. We are going to ask our mothers. But yeah, he's my twinnie. Glad to be here. It almost didn't happen. I almost had a trip somewhere, but I decided, this was more important. So I came to meet you guys in person and to discuss what I do. You're not going to get a sweatshirt, but we're going to do something very interesting. Marlon had said I should present for 20 minutes. That's an outrageous proposition because I don't believe people should speak for 10 minutes uninterrupted. So I declined to make a presentation. We're just going to have a conversation. But before we start that, instead of me telling you, we always say, show, don't tell, if you're telling a story. So what we're going to do is we're going to test drive the MIS so that you know exactly what we're here to discuss. So if you have a smartphone, and I suspect everyone does, save this number. I'm going to say it really slowly so that we all have a chance to save it. 077 66 40 888. I'm going to say that again. 077 66 40 888. Save it however you like, but I suggest you save it as MIS. It's quicker for everyone concerned. Right. I'm going to give everyone 5 seconds to save the number and open it in WhatsApp and say hi. Okay, so this little exercise is going to take 1 to 2 minutes so that we can actually do what we came here to do. So is everyone said hi to that number? Okay, I assume you have. So what you're going to see is a menu list. I want you to do whatever you like, choose whatever you like, and proceed until the logical conclusion of whatever it is you're doing on your screen. I'm going to give you 1.5 minutes. That should be more than enough. So choose any menu item and follow the prompts until the logical conclusion of it. It should take you 1 minute or less.
And for the online audience, you'll get to maybe summarize afterwards.
Yeah, but they've got phones, don't they?
Oh, okay.
Yes, I hope the online audience is also participating.
Also
yes, yeah. So that you can also get to participate in the fun. So as you're doing it, if you pick up a bug or an error or something you don't understand, you can then have the opportunity to ask me questions later. But yeah, for now, it's just so that you can get a feel of why we're here and what we do. It's far more interesting than giving a whole speech, isn't it, Marlon?
Yes. Interactive is the key. It's a key strategy, interactive engagement.
Oh, great. So am I going to get paid for my appearance here, you think?
I thought it's the other way around.
I should be paying you. Oh, good. Maybe coffee, guys, just something. Okay, are we done?
Unfortunately, I didn't receive this.
You couldn't receive what? Okay, it's fine. That is exactly what I want to find out from you. So if you have problems, we're going to get to that. You're going to tell me what problems you encountered.
Oh, the other thing I forgot to mention, she's a former lecturer here. So if there's anyone who did health informatics at master's level, yeah, she was part of that department. Are you still? Okay.
No. I left. Yeah. You can have too much of a good thing,
Yeah.
Okay, so I imagine everyone else is done, but yeah, you can keep playing around with it. You're one of the first people in the country to use that, so consider yourself very fortunate. But yeah, Marlon, I think that by way of introduction, I think between you and the chatbot, I think everyone seems to have an idea of what I do and who I am.
Okay, and for those maybe that were online and for the recording, maybe to just then a summary of what the MIS is.
Okay, so MIS, right, assuming you don't have access to the chatbot at the point, it's an information service, the medical information service. So what it does is, like you said at the beginning, there's a transparency problem in our health system. When someone wants to find out where to get a certain medicine or where to get a certain health service or a device, they have to go around looking around, asking randomly, relying on word of mouth and unsystematic searches really, and that's not always successful. So I thought, let's have something systematic that people can just use, something that is accessible. So it's on WhatsApp that people can just use and find out where to get things without having to bother with word of mouth inquiries and the like. Interesting story. Yesterday, my mother was in a small traffic accident. and she required a number to Borodo police station. So she calls me. So I actually did use MIS, the chatbot, because the police is also one of the menu items to get a number to call. And so I was very pleased by that. So my mom is one of the first legitimate users of the service. So I'm pleased by that. But yeah, that's basically what MIS does at this point. I can't say what it will be doing tomorrow or 2 years from now, but at this moment, that's what it does, provides information to members of the public who have access to WhatsApp.
Yeah, it certainly has been evolving over the years. I think for the guys that maybe it's their first acquaintance, your background as a pharmacist, there's one key problem that we have. Just wait for us. Well, there's one key problem that we have in Zimbabwe, which is accessing medicines and getting information for medicines. So that is the origin of MIS. And as someone was a pharmacist, she used the understanding from being in that industry to then come up with a solution. Yeah, maybe if you may talk about that key service that the anchor, if I might call it the anchor service for now. Yeah.
Okay. So yes, like you said, I was a pharmacist. I was just fresh out of college. And I used to work at a very busy pharmacy because I have not asked for permission. I will not mention the pharmacy, but very busy pharmacy. And people would ask us, because when they come in and we couldn't fill their prescription because the medicine that they were seeking, we did not have at the time, they would ask us, so where do you think I can find this? And sometimes when we were not very busy, we would call around other branches or other friendly branches to ask if they had the medicine in stock, then we'd direct the patient there. But usually we're very busy and we'll just ask them to try again in a week or two, or to move around asking. And I said, I remember this statement very vividly. I said to my colleagues, isn't there someone with a crystal ball? No, you could just sit by the roadside with a crystal ball and charge people $1 each to tell them where they can get their prescription filled, so that they don't have to walk around, asking at every stop. And we all get a good laugh about it. But it kept bugging me. So 2 years after that, 2-3 years after that, I decided, you know what? We don't need crystal balls. We have the technology, to do this. So I then decided, let's do it for everything, I will tell you how it became a pharmacy information service. But yeah, I decided, let's do this for every health service. So I thought this was not a big deal. So I started recruiting providers to sign up for the medical information service. And then the regulators did not think this was a good idea, because they thought it was a clever way to advertise health services and medicines, which at the time, and I think still now, is very restricted. So they shut me down and decided, well, we can't let this go on. So for 1.5 years, I engaged regulators, trying to convince them that this was a necessary service and it was legal. But they insisted that it was not legal. So what we ended up doing was I thought to myself, let's find a judge, who can interpret this law for us, so that they can either tell me that, no, this is really illegal, or they can tell the regulators that, no, it's not legal. So I got a very helpful lawyer who's a national treasure, really, in terms of constitutional law. Professor Maduku, I don't think he'll mind me talking about him. So he decided to represent the MIS at the High Court, because our argument was, first of all, there's nothing advertised. There's no advertising involved here, so it was not illegal. But even if this was advertising, and we didn't think it was, the Constitution provides for the right to information. So this is a basic right in the Constitution. So whatever law sort of stands in conflict to a constitutional right is by rights an illegal law. So we went to court on that basis to say, no, this is a constitutional argument. People have the right to information. And the judge agreed. So it was all good and well for 24 hours, until 24 hours later, the regulator appealed that decision to the Supreme Court. So they did not agree with that ruling. So we ended up going to the Supreme Court. Long story short, the Supreme Court upheld the judgment. So here we are. Now we are able to operate legally with the regulators' approval or non-interference. So the reason we started off with medicines is because, like I said, I'm a pharmacist. It was easier to rally my colleagues behind the service. So we wanted to test it out with pharmacies first, before we included all other health services, which we're now doing, as you can see when you tried the chatbot. But yeah, that's how we became a pharmacy first information service.
Yeah, there's a bigger story to this. Like my initial remarks, I'm sure you've now appreciated why I said she has earned a place at the Heroes Acre. But you're still alive, even.
Yeah.
But certainly
Don't wish
in
for
the
my
annals of people that kind of made a lot of things possible. Her court case. Funny thing is, the regulator is now using her court case to kind of do something similar. So it's interesting. So that's another conversation. Maybe that will dive into another day when we talk about regulatory frameworks and policies and whatever, in same as far as digital health is concerned. So today we'll try to kind of go back to the actual business, like we said, the business of such services. So a good way to summarize a business, I think many people like Peter Drucker, and I remember Strive kind of quoting it. I think it's even there in the Econet. Say you can summarize a business into people, product, and processes. So we'll then try to then kind of maybe dive through those things. So maybe starting off with the product bit. So we understand what it provides now. It's a WhatsApp chatbot. You can get in there. It's not only for finding medicines, but also for laboratory services, ambulance service, for now, for everything. But if I were to ask a question, yeah, why put it on WhatsApp? Why not an app? Why not a website? Why did you go for WhatsApp?
Two reasons. Number one, WhatsApp is almost ubiquitous. It's the most ubiquitous phone technology in Zimbabwe, and it requires little data compared to using a mobile app, a traditional mobile app. It's the service that everyone sort of communication service that almost everyone has access to. So that was the main driver, to say which platform is most available to our end users. And WhatsApp was clearly the winner. And the second thing is, and this is something I discovered during my PhD, when you are trying to get something adopted, whether it's a policy, a roadworks, a way of doing things in the home, whatever it is new thing you're trying to introduce, it should mimic something people are already familiar with. It should not be completely new and radical. Otherwise, people will not adopt it as fast as you like. So people already use WhatsApp. They're already familiar with chatbots. They're already familiar with numbered options. If you use Apple Cash, you're supposed to be able to use this chatbot because it's the numbered items. So that was the reason. Those were two reasons why we chose to make this a WhatsApp-based service, which comes with its own challenges, but that's a question for another.
Yeah, from a digital inclusion point of view, it's a great stretch to go, because there are other players in the sector. If you've ever Googled a doctor's name, you might see one or two services that pop up. So it is a sector. It's not quite huge, but maybe we can expect it to be growing. But one thing that's different with MIS. So the other services that I know, they are mostly like specific. If they'll help you find a doctor, just give you information on that doctor, maybe their address and phone number to their rooms and so forth. But you went with a whole lot of other services, like so to try and get your thinking on why you had to make it as comprehensive as possible, like the number of if I may say, services or that people can find there, and why you went for such a kind of broad.
Right. So many reasons. When I'm looking for a medicine, I'm not looking for a pharmacy, I'm looking for a medicine, right? So I don't need to be told where a pharmacy is. I can see for myself where a pharmacy is. I want to know the pharmacy that has the thing I'm looking for. If I, for example, want a marriage counselor, I'm not looking for just any counselor. I'm looking for the service. I'm not really interested in who provides it. I'm looking for a service, a provider next. So you'll see that with MIS, we decided to not make it a provider finders service. It's a service finding. You tell us the service you're looking for first. You don't tell us that I'm looking for a gynecologist. You say that for example, this for argument's sake, I have this, and then we know that a gynecologist is the one who takes care of this. So we lead you to that person who does exactly what you said you wanted. And we decided to make it comprehensive because, well, we found that the problem is not unique to pharmacy. This is, like I said, the least transparent health system I've ever come across. And when we did the pilot with pharmacists, people would ask us non-pharmacy related questions. Oh, where can I get an MRI scan done? That was another motivation for us to build a very comprehensive service offering. And the other thing is also to attract providers, to attract pharmacies, you need to make the marketplace big. So to say that, okay, you need to sign up with us because millions of Zimbabweans already use it. Maybe they're not looking for a service you provide today, but they know the marketplace exists, and tomorrow they might look for something you sell or you offer. So that is also something we're thinking about, to say, well, let's expand the marketplace so that we can attract more providers to participate or to provide their information to us.
Something that you just mentioned there, that this is a very non-transparent
health system, yeah.
Health system, and it actually costs lives if you were to think about it. That like if you need an ambulance, then if you don't know the number to call, you might then demise. But then a lot of people end up going for alternative services that are not so healthy because they can't access credible information. So some people that then find themselves in the what's the most pleasant way to refer to? But I can't call them alternatives, but some of the quacks that are out there, it's because those guys make a lot more noise, and then people find themselves there. And unfortunately, they lose money, they lose valuable time, and by the time they actually get to the real services that can actually do them some help, it might be already somewhat too late. So it is quite critical. So while still understanding your product, there is the service that I loved about it, or that I think most people were so intrigued by, going back to the medicines part. So if you go around, which also speaks to the non-transparency that we have in our health. So one day I had a prescription for an antibiotic. I went to one pharmacy in town, like CBD, and the price was $9 for the same prescription. Then I crossed the street to go to a pharmacy that is directly opposite to the one that where I was, and the same prescription, but the price was $21. Then I was like, what is this? Then I drove about 1 kilometer away to go to the avenues to go to a pharmacy, same prescription, and I ended up getting those antibiotics for $3. So this is within less than a 5-kilometer radius, 3 different services, and they are same drug but different prices. So imagine then, as a consumer there, you are trying to find the nearest place as well as the most affordable. The economy is a bit tight, and then where do you go? I had to drive around, like from one place to the other. But with MIS, it would then mean you could then just ask, and then they'll tell you where the drug is available, and also you'll get 3 or 4 different suppliers of that same drug, and even the price. There's a time when I was looking for a rare drug for a baby in hospital, and I used MIS. And
I hope it worked.
the old one. No,
Okay.
not this one, not the current one, not the current chatbot version. Yeah, it took a bit of time, but I did get, within 30 minutes, I got 3 places that said, we have it here, we have it here, we have it here. And this was for a baby that was at Salim Kabi Hospital, was fitting. Yeah, we were looking for IV phenytoin or phenobap, for the kids that will be fitting. So yeah, I managed to then find a place that was offering a good price, and we got the drugs. So in terms of that, for that to be possible, it means you are collecting information in the background to create that product. So can you take us through the information gathering bit? How are you getting all this information, not only from the pharmacies, but all these other services that you are loading onto your product?
Yes. So we recruit providers, so pharmacies, labs and everything. So we invite them. It's voluntary. We invite them to sign up. So they give us all this information themselves. So directions to their place, what they charge if they want, it's completely their discretion. Some give us their prices, some do not. Some tell us which medical aid services they accept, some do not. So we get our data from them. So it's a very, it's grunt work. Because there's no, how sometimes you can scrape websites with algorithms and just get stuff. like I said, this is again, it's not a transparent health system. Information is within people's heads. It's not online. So we actually have to talk to people, interview them to get all this information to populate our product with. So that's how we get the information. Very manual process. We have to talk to people, ask them questions about, okay, so do you want us to tell patients this? Because there are some people, some entities who want patients to know some things about them. They actually don't want patients to know other things about them. For example, there is an organization that gives certain services for free and certain products for free to the less privileged, but they don't want that to be advertised because they want to determine on a case-by-case basis who qualifies for that pro bono service. So they'll tell you, no, want to list on MIS, but don't tell them this. So we give the provider that sort of discretion to decide what they want to tell us. But obviously, there are some basic things like where you are, how to get there. And our directions are so specific. We don't say, come to 135 Dudzai Mureyi Road. We say, come to 135 Dudzai Mureyi Road, behind the chicken inn with the broken sign. So the reason we do that is we sort of put ourselves in the patient's shoes to say, if you're looking for something, what sort of directions do you give someone on the phone? You don't tell them the address, you tell them how to arrive there, which is what we want in the end. So some of our directions are even in Shona, for the benefit of people who speak Shona. We are looking at Ndebele as well, but I'm not a Ndebele speaker, so that might be a bit of a slow process. I apologize for that. It's not intentional. But yeah, so we gather information manually by talking to providers.
So that's already going into the processes bit, how you deliver.
Oh, sorry, I forgot one thing.
Yeah.
We only do this for what we consider high value providers. I'm not saying other providers are more equal than others, but sometimes you have only one provider who offers a particular service in the country. That one, I have to onboard them myself, because I don't want mistakes. I want to be very sure about what information we're putting out there about that particular provider. For the rest of providers whose service offerings and everything is straightforward, they onboard themselves. What I mean is there's a link, they click on it, they enter their details, it gets stored. And then the MIS team verifies whether those details are correct, whether that facility is registered with the regulator, and whether we approve of the information that they've put there, and then we activate their participation after that.
That gave me flashbacks. So in Zim, we have to deal with a lot of quacks as well. So like she mentioned, before you sign up anyone in the system, you actually have to verify if they are indeed registered. So we do have people online, and they were someone even put the number for MIS there, and people were playing around with it, and Simbarashe giving some feedback. They say they're still waiting for a response, which is some feedback that you need. I think you're kind of like stress testing your system.
Yes. Yeah.
Teams. For the guys online, please just type in your question, or we might even be, if you raise your hand, we might see if you might be able to then ask a question, but feel free to engage. Now regarding processes, last bit of what you mentioned involved the important process of, let's say, customer acquisition. So you have gotten all this information, assembled it on this nice platform, and now we actually needed people to access it, which then goes to the area of advertising. So your comments and your approach for those that might not be aware, the ministry is trying to relax the regulations around advertising of health services, because that's what's kind of choking a lot of things. So there are processes at play that we hope might then result in a more relaxed regulatory framework, and you were also at the meeting. So my question is, maybe a comment on how the current legislature or framework is kind of inhibiting maybe your service in terms of customer acquisition, and if you have any tips of how you are managing it or going around.
Okay, so the meeting is talking about was a consultative forum that the Ministry of Health sort of convened so that we can discuss proposed changes to the advertising framework to enable patients or the members of the public to access information, without being hindered by restrictive advertising laws, which prohibit health service providers from advertising their services. Okay, so yes, I have mixed feelings from a health service provider or a health practitioner's perspective. I applaud the impending changes to the advertising framework, which will make it easy for healthcare providers to advertise their services. Just to note that this does not mean pharmacies can now advertise medicines. They are still prohibited by a different set of laws. But it will enable all the other service providers to at least advertise their services more forcefully than they are doing now. So I'm very pleased by that development. But from a business point of view, from a business owner's point of view, MIS particularly was very important precisely because of these advertising restrictions. Now, if those advertising restrictions are lifted, of course, MIS is still in business, but the value proposition is not as strong because providers can then just advertise themselves or provide information themselves. But yeah, so that's sort of the tension that's there. But I'm looking forward to seeing all these changes happening and to seeing how they affect the business of MIS. But yeah, that's the honest truth. I probably should not have said that, but
those views are shared with by many health providers. So we hope we'll get there. It's a good thing that the ministry is the one that is pushing. It's not us on the outside saying, "Yeah, we want this, we want this." The ministry is listening, and then hopefully to progress. But yeah, another important process related to business is the financial part. So we've established that we do have a problem in the country, which is the non-transparency, people having challenges accessing information. We understand the problem in terms of how it even costs lives. So this app is definitely needed, or such services are definitely needed. And I shared the story of how it saved me a lot of money, and it also helped me save time in terms of accessing medication. But apart from all that good that is doing, how is it going to be good for you in terms of your income or your profit, or as a business? Because we also hopefully have investors listening, and I know you do engage a lot of investors. So how do you talk about the monetization without maybe giving too much away? But yeah, how you make it a business and drive value and monetize?
Oh, I'm not worried about giving anything away because there's nothing to give away. I actually don't know. Okay, no, on a more serious note, at this point, we're actually not, very hell-bent on making money out of MIS, which is obviously something every startup owner has to worry about, how the tension between having money to keep going and also, achieving market penetration by making the service free. So what I would give are theoretical or potential revenue streams. For example, we could charge the end users, very nominal fee, something that is negligible for them, but when the volumes are high, it's actually a significant revenue stream for the business. So that's one. We have already integrated with EcoCash. Of course, the current EcoCash function is switched off because for now the service is free. But just in case we want to charge users at some point, the option is there. You can actually just make your EcoCash payment without leaving WhatsApp. I was very surprised that is possible. But yeah, that's one. Two, you can also charge providers, although we haven't actually decided how and if we're going to charge providers for listing on the MIS platform. But yeah, that is a possibility that is out there. So that's one. The third revenue stream will probably come from analytics. So all this data that we're getting from people by virtue of them asking us questions, we sort of now have access to certain information that the ordinary service provider would not have. And if they want that information, either for market research, business strategy, or whatever reason, we are able to sort of give them aggregated and anonymized data about whatever question they ask. So that is also another potential revenue stream. I've actually gotten some pharmaceutical companies asking me to let them know when I have enough data to sell insights, not to sell the data, but sell insights. I'll give you a nice example. There's a company, and they said this at a conference, so I imagine I'm able to repeat it here. They wanted to renovate one of their plants, their production plants. So what they wanted to do was to make enough medicines to stockpile and cover the period during which their production plant was under renovation. And they couldn't get enough data to sort of estimate how much they needed to stockpile because the system is just not transparent. Apparently, and this is a funny story that someone said to me, during the time when the Reserve Bank was engaging stakeholders on who needed Forex to import, So in a room, someone said, you know what? Grain millers in this country, no, we'll tell you to the last gram how much milling this country consumes. Pharmaceutical companies or pharmaceutical stakeholders cannot even tell you how much paracetamol this country consumes every year. So that sort of, murky ecosystem is what MIS is trying to solve.
So mentioned 3 potential ones there: analytics, then charging the consumer. The second one is charging the
providers.
The provider.
Yeah, it's
all right.
All theoretical.
No, yeah. And I think for the benefit of those that are actually here in physical in attendance, when we do our deep dive, we'll try to go into those revenue streams and then expand on them. So for the guys online, next time show up. But we do have a question in the comment from online. So maybe, yes, this is from Nyasha Maregere. She asks, she says, thanks for the background. And it was long overdue and it is much needed. So the question is MIS available for any service provider throughout Zimbabwe? So that we can share with our relatives outside Harare. So it's like, is it Harare only or it's umhlaba wonke jikelele?
No, it's not for Harare only. Of course, you find that most providers are based in Harare. But we've really tried, before launching, we've really tried to make sure that we prioritize services that have, or service providers that have a footprint around the country. So yeah, we have, for each service, we have at least one service provider who has a national footprint. So yes, you can actually share with someone in Kariba right now.
All right, so there's your answer. You guys will also get a chance to ask questions. Maybe before I give back to you, last maybe one of the sections, we discussed product, we discussed processes. Maybe let's go to the people part. So this is, even though there's technology behind the scenes, we are still dealing with humans. So there are people in terms of maybe MIS staff and like HR, and then there are people in terms of the users. So those are the customers, the consumers, the patients, and then we also have people in terms of the providers. There's something that you shared with me in the conversation back, but maybe it's good for everyone. Particularly looking at the providers and you're trying to get them on board. What are their fears? What are their concerns? How do you convince them to volunteer their information? Because maybe for those that may not know, the laws in Zim, if you are a registered health professional, doctor, pharmacist, whatever, etc., and you are associated with a service that is advertising for clients, it might not be your company, but someone is just using your details in their advertising. What happens is that the council or the relevant council, they look for you to say, Dr. Nyakabao, we have seen your advert under this platform. So you come for tea and biscuits and explain what's going on. So it means there's quite a lot of responsibility with providers. So yeah, maybe to go into that, your experience and how you're dealing with that.
Yeah, so this was a particularly big issue in 2015, 2016, I said during the background, because the regulator was very loud about how they were disapproving of MIS. So obviously recruiting was, actually we didn't recruit at that time because obviously it didn't make sense to ask people to do something that the regulator has clearly said is illegal. But fast forward to now, that fear has largely gone away. For several reasons. Number one, because technology is actually more ubiquitous now, it does not make sense for people not to be on a digital platform that informs people. And it helps that I can tell them the background and I can tell them who are finally approved I mean, who can possibly be above the Supreme Court? Maybe the presidency or the parliament. But it's sort of like it renders us, it's a badge of validation, if you want. So now it's actually, even if I don't mention the court case, no one really questions the legality of this thing. I was very surprised. I was prepared to do a whole pitch each time I visited a provider. But no, people are so receptive. Even the people who think are not digital natives, and they run these big organizations, they're very excited by this. And one thing I tried to do when I was recruiting providers was to start with the market leaders. So if you, for example, see a provider who has 15 branches in Harare alone, and maybe sees 1 million patients per year or whatever, and you are already, you've been struggling, a provider has been struggling to upstage that market leader, it's easy for you to then just also go along, because what are the chances that a very risk-averse market leader would engage in something that is dangerous for their business? So that is also a strategy we've been using. Recruit the market leaders first, and hopefully the others will just, as a matter of course, follow.
Yeah, you kind of mentioned something that I think we'll also dive deeper, go into the issue of positive network effects. And like what you said is quite smart. You know, you go for the influencers, and then if you just tell people that so and so are using it, like okay, it's fine. Any question from the audience here? Feel free, guys. And then guys online, you can also type in your questions. If you can raise your hand, and then you can speak and ask your question. Then the other people part is now the guys that work behind the scenes to make MIS available to the service. So last time I checked, even as I read out your profile, I did not hear about computer science in there, or software engineering, and or even WhatsApp engineering. I don't know if there's such a program. So yes, who are you working with? Who are the people that you need, and or how are you finding them? Yeah.
I've lots to say about this, actually.
Okay.
So yes, I like to hog all the credit. So anyone else who's not me is not going to be talking about MIS. But seriously though, I know it looks simple at the face of it, but at the background, there's a lot of software engineering, like you said, that has gone into this, months and months and months of hours that went into building something like this at the back end. And I worked with two very brilliant software developers, freelance software developers. They're local. I know where they live. Oh no, this is actually true. Their wives know me because I am always at their houses, So this is why I said I have lots to say about it. When I first started to look for developers, a lot of people who have never built anything, actually, ironically, they had very interesting views about who I should engage. And there was a lot of, and this is not to cast aspersions on offshore developers. They have their benefits, but a lot of people asked me to go on this platform where you find a group of developers and they bid for your project. You can get some for a very, very, very low log and giveaway price. You can get offshore developers, and India was talked about a lot. Get developers from India. They will do this in a week or two. I am glad I used local developers who I know by name and where they live and all that, and who believe in the project. And I'll tell you this, if you're going to build something, I feel like there's no generic solution about which provider or which developers you use, but you really need to make a very careful choice. So I'll tell you this, during the discussion about what we need to build, because I'm not a techie person, I'm a health professional. So I needed to talk about what I want in lay terms, most often in Shona, to explain to the developers exactly what I want to see on the screen. I couldn't have done that with a developer who can't speak Shona. And there are times where we have in-person meetings. There are times when they would drive to my house to collect a few things, papers, even a device. There was a time they came to collect a device. I wouldn't have been able to do that with an offshore developer. I would have to find FedEx, send whatever I needed, so it would have not been easy. Because they are so invested in the vision, I'll tell you something. This is a very interesting story, and I don't think I'll ever forget it. So when you're building a chatbot, because WhatsApp is owned by Meta, there are several things you need to get verified by Meta, and Meta is notoriously difficult to get cooperation from, particularly if you're from, I think, this part of the world. So we had struggles trying to get our WhatsApp number verified so that we can be able to access the infrastructure to build the chatbot. And usually there are these third-party providers who mediate between an entity and Meta. And I'll give an example. Twilio, does that. But the problem with these providers is they are so expensive. They will charge you per message, whether it's a message going in or going out. Can you imagine all these messages you've been sending? I would have been charged for each message, for each interaction. Meta, on the other hand, has much more favorable payment terms. You get charged per conversation in a 24-hour period. So even if you go home and give your uncles and aunts the opportunity to try the chatbot, how many ever times you want, I will only be charged for one conversation. But again, getting verified by Meta straight is difficult. We're about to give up. We're about to go the Twilio route, which would have bankrupted us during the scale process. But one of the developers insisted. It became something of a personal mission of his, saying, no, we're going to go through Meta. And while the other developer was saying, you know what, there's a big telecoms company which tried to go direct to Meta. They failed. They to go through Twilio. So I was not very confident. But the next day they called me after weeks and weeks of delays. Oh, now we got approved by Meta. And, our chatbot can now function on a proper Meta platform. Now, if I had used a developer who's number one offshore, who did not believe in the vision, they would not have insisted on persisting with trying to get verified by Meta directly. And I can't say enough about those guys. If you want to know about them, you can go on the MIS website where it says our team. There are two gentlemen there, with their little profiles there and everything. So you can check them out. You can, if you know them, if you can find them, you can also network. They are brilliant. Most of what they know, I think they taught themselves. But they do get the job done. If I have a query, I wake them up, so they are very available. You need to find yourself a team that is dedicated to the vision, that you can access, most importantly, that you can access. So that is the biggest, I think, contribution to this discussion that I can make.
Yeah, I was about to say the same thing, that for everyone who's here, to get to understand that it is actually possible to go directly to get straight to Meta, because I remember some time, I had to go through Twilio and then the costs that were there. So that's a big plus for people to just know that it's possible. It's not easy, but it's possible. And in the realm where we now have digital services withholding tax that has been introduced, it means Meta is charging a fee. Then the intermediaries, the middlemen, are also adding their markup on it. And then we now have a tax on top of it. And then we might, as a local company, might have to put on our markup on that so that we recover. So it then makes the service quite expensive. Right, since we are now at the top of the hour, one last chance for anyone to ask a question live before we switch off the mic. Yes, forgive.
I was speaking to a number of questions when you were presenting.
Well, we can ask one because you are here, so you'll get a chance to ask some more after we say goodbye to the Zoom audience.
So my question was around business model. Basically, how the chatbot for the application is fund to sustain its work every day. And I would like to, when you started, was it just for the public service, or it was a business model, some sort that you were looking at how would be sustainable in this way? Data that you're looking into, was it subscription? And I do understand it's been a while since you started this project. How are you going to sustain the project? Did you get investment?
Okay.
So that's quite an important question. Maybe you answer part of it, and then once we say goodbye, you are here. We can even go into
Okay.
So you can answer.
Yeah, the short answer is I like to do interesting things, even if they don't pay me well. I remember my mother said to me once, because I used to run half marathons, and she ended up asking me if I get paid to run these marathons, because she doesn't understand why anyone does anything that doesn't pay them. But yeah, I like to do interesting things, and this was the motivation was, let me just do something revolutionary that will outlive me. I'll figure out the money later. That's just who I am. I'll figure out the money later. But to answer your question very quickly, Potras, the telecoms regulator, has a digital fund, and this is the information that is useful also to you, I hope. Annually they give away money to digital innovations that are still at the idea stage, so that you can have a bit of money to test out the idea and build a minimum viable product. So we benefited from some of that money, which helped us to do the pilot. There's a bit of funding going around in the country, actually. I will discuss that more later, but you'll be surprised at the amount of funding that is available to young people, or even less young people who are doing digital innovation work. Yeah, but we can talk about that after the Zoom audience has left us.
Okay. For those that are still online, yeah, that's a bit of some helpful information there. The Potras Innovation Challenge. Yeah, if you see it, sign up. You might get some funding to help your idea get started. So by that top of the hour, we want to thank the 15 people that were online. Thank you for your questions and comments. And we invite you to follow our LinkedIn page. You can then get to see some of this video, as well as the past sessions that we've had. And for those that want to be members of the Zimbabwe Digital Society, continue following the page for updates on that. With that said, we want to say goodbye to the online audience so that we continue. I want to thank you for attending. We want to thank Zimain for hosting us. And yeah, thank you very much, Dr. Mureyi, for that session.
Do you know what's going to be on next month for the same webinar?
The thoughts are we're trying to put something that's on electronic health records, to get a couple of players in the industry to come together, but it's still in the works. Yeah.
Okay, cool. Thank you.
All right. Thank you very much, everyone. Let's end this.